Hello guys, welcome to my YouTube channel. This is Kanika Arora and you're watching my YouTube channel The Medical World. And our today's topic is the last part of the video, that is the head to toe examination. So we will know about the sequence, what to check when we do head to toe assessment. So let's start the video. Our first topic is about the journal status. In the journal status, first we will measure the vital signs of the patient. Then we will take the heart rate, blood pressure, temperature, pulse oximeter, respiratory rate, and pain. We all know this is the vital signs, 6 vital signs, as there is one video I have described all the vital signs. So to check the general status of the patient, we will check these vital signs, 6 vital signs. Our next topic is about the nose, eyes, ears, and throat. How we have to examine these things. First, we will observe the colors of the lips and moistness. Second, inspect the teeth and gums. Assess the buccal mucosa and palate. Next is examine tongue. Next, examine at vulva, examine tonsils, palpate nose and assess the assessment, check septum and inside the nostrils to see is there any type of bleeding over there, and also verify the patency of nails and check the patient's sense of smell as well as palpate the sinuses to check is there any type of disorder. Next, we have to assess the patient hearing with the whisper test, turning fork test, which is also called the Weber test or the Wiener test. In this test, the turning fork is taken and it is the vibration. It is kept on the scalp and the vibrations are felt, and the ear testing is there through this type of examination. Look inside ear. Look inside ear to check is there any drainage or the tympanic membrane, or you can say the eardrum is not damaged. Then assess the ear discharge and tympanic membrane as I have explained now. Check the conjunctiva and the sclera. How you can check? I have told you you want the pen light. Pen light is used for checking conjunctiva as well as sclera and assess the eye symmetry. PIPPI is also done. Check the vision with a Snell chart. Snell chart is the chart you can see, it's very common in the doctor's office. Check 6 cardinal position of the glaze. Now I will explain how you can detect any changes in the neck. First, you have to palpate the lymph nodes, then observe and palpate the trachea and the neck, then check for jugular venous detention, check neck range of motion, check shoulder shrug with the resistance. Next topic is the respiratory. Listen to the lung sounds front and back, assess respiratory expansion level, ask for coughing and palpate the thorax. And next is cardiac. How you can detect is there any abnormality in the cardiac? First you have to palpate the cataract and temporal pulses bilaterally. Then listen to heartbeat. You should know the normal values of the heartbeat. If it is low, then you have to report immediately to the doctor, and if it is higher, then there will be any abnormality in it and it should be reported. Now we will talk about the abdomen. First, inspect the abdomen. Listen to the 4 quadrants of abdomen for vowel sounds and palpate it further to check is there any pain or tenderness. Ask the patient about the problems of with vowel or blood. Next is the pulse. You have to check the pulse in arms, legs, feet, including the radial, femoral, posterior, tibial, and the dorsalis pec. So what comes under the extremities? Assess the range of motion and strength in arms, legs, and neck, as well as assess sharp and dull sensation on arms and legs. Check for the capillary refills on fingernails and toenails. How you will detect the skin? Skin check it for the skin turgor. Check for lions, abrasions, and rashes. Check for tenderness, lumps. Is there any lions? Check if the patient is pale, clumsy, dry, hot, and flushed. So, as we know, skin is the largest organ in the body, and if there is abnormality in the skin, such as the if the color is pale, then you can easily detect the disease, that is the patient is anemic. What comes under the neurological? Neurological is related to brain. Check that the patient should be oriented to the place as well as on the date. Assess the gut, in which have position or the posture the patient is having. Check for the coordination. Assess the reflexes and check the Glasgow Coma scale. Thank you for watching my channel. I hope you like this channel. So this is one of the most important video, and if you're a nurse doctor, this is very important for you. You have to, it is compulsory to do head to toe examination for your patient, and if you know all the things, you will easily find out any abnormality and go for the further step, that is the diagnosis and the treatment. So don't forget to just subscribe my channel. Thank you.